In this podcast episode, Dr. Richard Bosshardt, a seasoned surgeon, shares his insights on the evolving landscape of the medical profession, particularly in surgery. He discusses the implications of diversity initiatives and the perceived decline in surgical standards, raising concerns about the future of patient care. Dr. Bosshardt begins by recounting his journey as a surgeon, highlighting his membership in the American College of Surgeons, ACS, and his commitment to excellence in the field. He reflects on a pivotal moment in 2018 when he became aware of significant changes within the surgical community, particularly regarding the emphasis on diversity and inclusion over surgical excellence. This shift, he argues, has led to a troubling trend where the quality of surgical training and practice is compromised in favor of meeting diversity quotas. The conversation takes a deeper turn as Dr. Bosshardt discusses the societal upheaval following the murder of George Floyd and the subsequent rise of movements addressing systemic racism. He notes that the ACS, like many institutions, felt compelled to respond by forming committees focused on racial equity. However, he expresses skepticism about the effectiveness of these initiatives, arguing that they often prioritize diversity over merit, potentially endangering patient outcomes. A significant portion of the discussion revolves around the assertion that surgical outcomes are influenced by the race of the surgeon and the patient. Dr. Bosshardt challenges the notion that a surgeon's race can determine the quality of care a patient receives. He cites a lack of scientific evidence supporting the idea that racial matching between surgeons and patients leads to better surgical outcomes. Instead, he emphasizes that surgical competence should be the primary focus, regardless of the surgeon's background. Dr. Bosshardt raises alarms about the declining standards in surgical training, attributing this to a combination of factors, including reduced residency hours and a shift in focus from rigorous training to accommodating personal comfort and work-life balance. He shares anecdotes of young surgeons who lack essential skills and experience, raising concerns about their ability to perform complex procedures independently. This decline in training quality, he argues, poses a direct threat to patient safety and the integrity of the surgical profession. The podcast delves into the ideological underpinnings of current medical practices, particularly the influence of critical race theory and social justice movements on medical education and practice. Dr. Bosshardt argues that these ideologies often overshadow the fundamental principles of medicine, which should be rooted in science and patient care. He expresses concern that the focus on identity politics may lead to a generation of doctors who prioritize social justice over clinical excellence. As the conversation progresses, Dr. Bosshardt articulates the potential consequences of lowering standards in the medical field. He warns that patients may suffer as a result of these changes, as the emphasis on diversity and inclusion could lead to less qualified surgeons performing critical procedures. He emphasizes the need for a return to a merit-based system where surgical excellence is the primary criterion for practice, rather than race or gender. Dr. Bosshardt concludes the discussion by calling for accountability within the medical community. He urges fellow surgeons to speak out against the erosion of standards and to advocate for a return to a focus on excellence in patient care. He emphasizes that the future of surgery depends on the willingness of medical professionals to uphold the highest ethical and professional standards, ensuring that patient safety remains the top priority.